Everyone. It's Kyle again. So I think we're all here. So we're good to get started. And I wonder if we can go to the agenda first and see who's going to be doing the welcome from RNAO. Doris seems to be running a little bit late, but Angela Cooper-Brathwaite, she is our board president, and she's going to be saying a couple opening remarks.
Good afternoon, everyone, and welcome to Nursing Week. And this is our 20th Take Your MPP to Work. And I'm so glad I could join you at Sandy Lake for this momentous occasion. And I welcome our MPP. And I hope I say the name correctly. And I'm going to say Saul Mamakwa. If I'm not correct, you have to tell me afterwards. All our distinguished guests, all the nurses on board and other members of the healthcare team. And I welcome you to joining this occasion. And I bring greetings on behalf of RNAO. I want to thank you for who you are and what you have done. This year is the year of the nurse. And it was designated the year of the nurse more than a year ago. And we never knew we were going to be experiencing something like COVID-19. But COVID has highlighted who we are as nurses in providing care for families, for the community, and for all Canadians. I want to say during Nursing Week, we are commemorating the 200th birthday of Florence Nightingale, who is the founder of modern nursing. And during Nursing Week, we take pride in acknowledging who we are as healthcare providers and what our contributions are to Canada and the rest of the healthcare system in Canada. So I see you as committed, compassionate, caring, diligent, culturally sensitive, and really outstanding and courageous nursing leaders and practitioners. I see you for what you've done. You've provided care, selfless care, tirelessly to not only the people of your region, but for the rest of Canada. And these greetings come from the bottom of my heart. And I say, bravo, kudos to you, work well done. You have worked hard and long hours, and you go places where people are afraid to go because you're courageous, because you care, and because you want to meet the needs of the people in your community and other parts of the world. So God bless you, and I hope you have had a great Nursing Week thus far, and we have one more day to go, and I hope you have the rest of it, and you are refreshed and renewed by what you've learned this week. Thank you.
Thanks so much, Angela. So I'll turn it over now to Heather and Cheryl for our next agenda item.
Heather, go ahead.
Okay, so I'm Heather Mikas. I'm the nurse manager for Sandy Lake, and I too want to say Happy Nurses Week. But I also want to expand that because in our communities, we don't have formal nurses that have done degrees or had that opportunity to go to a city and get that education. But Greta and Carmel, you're sort of included in this as traditional healers, as medicine women. You set an example for your community. I've worked with Greta. I've worked with you for a long time. You are definitely one of our crew. You are a nurse who's put in a lot of hard work, a lot of dedication, and a lot of time over the years. And I'm glad that you can be on the line too, because we have to somehow find a way to start celebrating some of the natural caregivers that are in our communities that might not have an RN behind their name, but they're certainly key to delivering health services. So that's it for me. Thanks very much, everyone.
Hey, it's Cheryl, and I'm calling in from home. And I just want to support what Heather has just said. I am so inspired and so excited about what's happening today. but I'm even more so with everything that's been happening over the last weeks and months and yes, years. And I've been a member of RNAO for over 30 years. I hate to give my age, but yeah, it's been a long time. I started as a baby, I have to tell you that. So anyway, it's over 30 years. I've met so many people that have molded who I am, both personally and professionally today. And I just totally admire the people that I work with in Sandy Lake as well. People say to me, how long are you going to work, Cheryl? Well, you know what, as long as the fit is right. And I'm just totally enjoying who's there. To work with as the best practice spotlight organization within Sandy Lake, to have Greta and Carmel and Lindsay on the team, and Joan and Ambrose, and I could go on and on and on. And the band council have just been amazing. And it's been unnerving over the last few weeks and really into months now. But when I go back to Sandy Lake, it is so reassuring to know everything that's been done. And so what we wanted to do is spotlight today, not only what we're doing with the Best Practice Spotlight organization and the clinical practice guidelines, but also with what we've been turned to, which is the COVID-19 and the changes and the teamwork that's occurred because of that. So without any further, I'm just going to hand this over, and Joan and Ambrose Lisa can elaborate on really what's happening too.
I think the agenda says that Saul gets to talk next.
I apologize.
Okay, it's my turn.
Yeah.
We're waiting.
All right. Miigwech kaganas tame kumawas naman maganingaw si yamianuma mama tawa kumaingi sikatan with Sandley kaya kuachaminawa John communicating with kaki kagitan kimnamba. Anyway, just saying greetings to Sand Lake and also the people I used to work with, like Ambrose and Joan, and then also to be a representative for Sandy Lake and for the riding of Kiiwetinoong. I'm very glad to be here to take part in this as we celebrate Nursing Week, where we recognize the nurses' contributions towards caring for and saving the lives of people in Sandy Lake and caring not only that throughout Ontario. But I know today is certainly a difficult time. The work and is more important than ever. We have to understand too that nurses have made certainly exceptional efforts in improving the healthcare system that meet the needs of our communities, and we've always done that. I had an opportunity to work with healthcare over the last decade or so, and health has always been my passion, and trying to address the issues that face us. And I know one of the things I struggle with, that being at Queen's Park, which is a provincial responsibility, versus whatever's happening in Sandy Lake with the federal responsibility with the care of healthcare. Sometimes people throw our, the jurisdictional ambiguity of the way the system works. So it's so important. And that, like sometimes it's not equity. Sometimes we're fighting for equity and equality, but just basic human rights that everybody in Ontario deserves. And sometimes people don't understand that, who we are, where we come from, because of those jurisdictional things. Because of this COVID-19, the significance has become even greater as nurses remain on the front lines, to continue the care for the ill. I know we are facing, as a community, as a province, even in the world, unprecedented times with the pandemic. Nurses working in First Nations continue to work very hard to ensure that we receive the highest quality of culturally appropriate care and testing and treatment, and that that does not happen without the leadership of the community, whether it's the chief and council, whether it's the health leadership. But I think it's also important that we thank the nurses from other communities, and to be able to continue that support throughout the north, but not just Sandy Lake, but the north. So it's really important that we recognize that. I know, although this pandemic has highlighted the absolute need for nurses and the healthcare system, like the federal system I'm talking about, but we also we need to recognize them as heroes. The nurses on a daily basis, not just this time, but the efforts to improve the quality of life in Sandy Lake, and not only that, throughout the north, throughout Kiiwetinoong, and I acknowledge other nurses as well. And Lisa, it's good to see you there at the community. I know it's been about a while since we crossed paths, and so I really like that, and that you being on here. So I like to say, I hope I can visit Sandy Lake soon. Miigwech.
Great. Great. So I'm just looking at the next item on the agenda, and it says introductions list to be circulated. Did you want to go? Okay, so, all right. And then, so we want to have a look at that. Great, we have a great team. And then, Greta, were you going to talk about the BPSO?
Oh, yes, yep. Here is an aerial view of Sandy Lake Nursing Station and the land ground picture, as you can see. And judging by the picture, the ground view, it's not quite as it usually is. It's a pretty busy place. That's all right. Next. And I'd like to introduce. We are the first cohort in the rural remote First Nations in Northwestern Ontario, and with the nursing station involved since March 2019, and won over 9,000 sites in academic settings internationally. We have a steering committee that includes traditional healers, elders, and new moms. And we focus on pre and post-natal women and also their families.
Can I just ask, Greta, before you go any further, Saul, do you know the best practice spotlight organization, what it means?
Best practice.
Or are you going to say that, Greta? So Saul gets an idea of what does this mean to be a spotlight organization?
Well, it's the first Indigenous focused best practice where we implement our best practice guidelines, and we have chosen 3, and that's further down.
Okay.
Where I feel that we are one voice that speaks for all of Northwestern Ontario, because we are the first one for Northwest Ontario First Nations.
Okay. Great.
And this is our Sandy Lake team. Back in March of 19, there's myself, Lindsay, Joan, Ambrose, and Cheryl. And Carl joined us in June. And the 3 of us are doulas. That way we can work closely with prenatals. And Carmel is a certified doula, where she assists the nursing station, the nurses, if there's a delivery here at the nursing station. So she's basically on call whenever
Crisis
this
happen.
happens. Whenever this happens, yeah.
Yeah, fantastic.
So
And
Put that in.
once a year.
Mhm.
And you're also champions too.
Yes, we are champions.
and you'll tell us what the guidelines are, right? I see you holding the 3.
Mm-hmm.
How do you
And it's on the next picture, I think.
Okay.
See?
Well, there you go.
Choosing the person and family-centered care. There's a E missing there, and we're promoting the nicotine-free health and wellness in Indigenous parents, families, and communities. But we're still waiting for the new guideline to be out, and I think that's September.
Yeah.
And assessment and interventions for prenatal depression.
Fantastic.
And this is basically the 3 guidelines what we have chosen. Establish relationship, building trust and respect as a partnership. Meaningful engagement as an active partner in their health care. Gather information on the meaning and experience of health using the person's own words to improve care provided. And this is an opportunity to influence change in individuals, community, and world.
You know, I'm looking at the 3rd bullet and just what you've said about all those helping in the community. This 3rd bullet really gets at the heart of culturally competent care, doesn't it?
Mm-hmm.
Yeah.
True.
Oh, good.
And these are our programs that we had initially started with in the Inchik, what do you call that? Inchinook.
Inukshuk.
In Inukshuk.
Yeah.
And the programs that are outside the rock formation is what we plan to implement together in the future, so we can grow.
Okay, lovely.
And this is Sandy Lake Health Authority. We have a lot of programs that provide a variety of services. That's the prevention, promotion, urgent, emergent, rehab, supportive, palliative, and all these support the beginning of life to the end of life.
Mhm. Excellent. Oh, if you go back, I just wanted to ask, what was the red? Why are some red and others are in the black?
These are what are available at the nursing station.
I think the red ones is the nursing programs and the black is the community programs.
Oh, okay, okay. That's just what
I
it
don't see
said.
Sol. Where is Sol?
Here, right there, and Doris has joined us.
Well, I thought it started at 3:30.
Oh, sorry. Yes.
That's what
well,
was on my schedule. Sorry.
Hey, Doris, how are you?
Good. How are you, Sol?
I'm good.
I am so good. I'm so glad that you join us today. I'm so glad that you're an MPP.
Yeah.
Kudos.
Yeah.
Kudos.
Thank you very much.
Thank you. Thank you.
The reason that we wanted to include this last slide was because you could see the magnitude of everything that, not everything, but many that are within the Sandy Lake Health Authority. And we were working in silos. That was a problem because we had prenatal care within, we had prenatal care within the community, and we weren't crossing over. And so with this overall, we looked at how we could work in a different way. And that's why I wanted you to see what was here and then the integration that is occurring.
Oh, that's fantastic. And that's been really supported through the BPSO and the guidelines you're all implementing. Fantastic.
who's talking with COVID? Is that through me?
So
No?
Greta or Cheryl, were one of you carrying on that?
Yeah.
Actually, Joan and Ambrose, as well as Lisa, talking about, John was going to, he was invited, but he's not able to. So really, how has life changed at Sandy Lake? Because we were slowly increasing in what we were doing, but all of a sudden, lo and behold, COVID hit us like everyone else, and we had to look at life in a different way. So how have things changed?
Yes.
Ambrose said with our changes that we're all wearing our masks.
Yes.
Ambrose, you're still not in the picture, but.
So I'll just open up with a few remarks and then Ambrose and Lisa can continue after me. So my name is Joan Ray. I'm the health director for Sandy Lake. And since COVID-19 has been around, at first life still continued. So we have to try to bring to attention that this is a serious matter and nothing to fool around with. So now our life has changed here, even at the clinic and in the community. People are more aware of what self-isolation is, and it's hard not to shake somebody's hand. So that's one of our customs in Sandy Lake is when we meet people, we shake their hands or give them a hug, and we can't do that no more. And that's really a change in our community. And even at the clinic here, when people come in, we have to implement that they wash their hands as soon as they walk into the clinic. So that's another change that's come. More people are washing their hands, and we've been promoting washing hands on the radio and posters. So even people at the airport are saying wash your hands. So everybody's washing their hands. And now and even with the younger children, like our babies, I have two great grandchildren. So I broke my wrist. So I had to go to Thunder Bay, and on arrival, I had to self-isolate for 2 weeks. So I told them, so you can't visit me. I told them, you can't visit me. And then they said, why? And so I said to them, because of the big sickness. So that's how they understood. They understood that they couldn't visit me because of the big sickness.
Oh.
That's how I explained to them, and they understand that.
How old are they?
Yeah, so they understood that how I described it, because there's no word to say coronavirus in our language. So we call it the big sickness.
I think that's a good name, big sickness. We should all call it that.
Better than, yes.
So that they couldn't visit my house. So that's how they understood that. But people that come for medical, go for medical and come home, they have to go through that. So it's hard for them too. And it does get really, it gets to you after a while if you're in isolation for 2 weeks without no contact with other people, just you and whoever you're in isolation with. So it does get to us. So that's a change that community is going through, and we're trying to tell them they have to do this for the safety of our community and the safety for them.
Are they following through for the most?
Following, yeah, they are.
And what about the testing? Because we have heard a bit that sometimes is a challenge for people to come forward and say they have symptoms and get tested. How is that working?
Well, with the COVID-19 being around, people are more, they don't want to come to the nursing station. We're trying to encourage them to come to the nursing station. It doesn't mean that they just think at first that the nurse is going to put them in isolation if they develop any symptoms related to COVID. So that scared some people off, but we're trying to advertise that it's still okay to come, and we're taking safety precautions here. The nursing station. So they're starting to come around again. And
May, a quick question on the opioid crisis. Has that become bigger because of COVID and all the challenges, and because of the stress and the inability of people to get together, which help, you know. How is that? What's happening with opioid crisis?
Yeah, I don't know that May is on the line, but I'm sure others can answer.
Oh, because May runs a program there. That's why I was asking May. Okay.
Program in Thunder Bay. Thunder Bay is 600 kilometers from here.
No, I know, but I want overall how it's working, right? I thought she would be there too. Cheryl and my colleague, that Lisa and others, what can you tell us what's happening with some of the pre-COVID challenges?
The other challenge we have as a community, like for myself, is testing. I can't have a testing unless I develop symptoms or if I cough or have sore throat. That's the only time I can, even if I ask for a test, they won't give it to me unless I have symptoms. So that's a challenge here in the north. And
that's a challenge, just so you know, everywhere. Huh? I know of a very close colleague of mine, total symptoms she had, huge symptoms, and health professional still not tested. So this was like 3 weeks ago. Maybe it's changing, but you know, we know that the government said health professionals are a priority, but not all health professionals were tested because of the shortage of.
Lisa, who is doing the testing in your community?
So the testing is being done by nurses, and so we're following the provincial guidelines, and we're testing broadly. So anybody with respiratory symptoms is being tested. So we have plenty of swabs. The challenge, of course, is the delay in getting timely results.
The result.
So Sioux Lookout has the capacity to do PCR testing and has been approved to do COVID testing, but they're only getting a tiny number of cartridges. And so our samples are being sent to Toronto, so it can still take a week to get results.
Oh, yeah.
So any advocacy to help promote Sioux Lookout getting sufficient test cartridges to be able to test for the northern communities in a timely manner would be really appreciated.
So Lisa, do me a favor. All you need to do is send me an email, really. So I have it in writing.
Okay.
Maybe I don't have the chat box here. I don't know because I don't know what's going on with my computer. But Kyle or Imagine, can you write my my email?
Yeah.
Because that, and then I promise on the spot we will start to push for that. Yes.
In terms of substance use, as someone was asking a moment ago, we have a very large Suboxone program, so opioid substitution program.
Yeah, that's why I was talking about May, because I thought that I actually thought May will also join and share what she's doing in her community. But that's okay. Go for it. How is it working with all these challenges of?
So our Suboxone program has about 280 participants. We have a few more people on the wait list. We're trying to figure out how to find a safe way to join them. But that program's going well. They've been implementing for 2 months now the, distancing, the cleaning, all of that stuff at the program. We've increased the number of carries that people get slightly. We've used pandemic funds to acquire lock boxes so that those who have carries at home can lock them up so their kids don't get at them. For the most part, most people who are using opioids that wanted treatment are now in treatment. The larger substances of use in the last number of years have been cocaine and alcohol. So the supply of cocaine coming into the community has really dropped. So many people that were using cocaine more regularly have been cutting down. Many people who had been kind of thinking they should cut down, but were having a hard time doing that, have used this opportunity to do so and are actually doing quite well. Alcohol, we've talked about that with, at the community leadership level, is that much of the alcohol, there's a mix of homebrew as well as vodka and stuff that's smuggled in. So just trying to encourage people that do drink, instead of gathering in large groups to do that, to, even though this is a dry community where they're not supposed to, we know what's happening, right? And so, you know, pick up your jug, go home and drink, but don't gather in large communities, in large gatherings, because we know we also don't want to cut people off cold turkey, because we all know that alcohol withdrawal can be very serious. And so even though that messaging is contrary to the official dry community, that's something that even chief and council have gone on the radio and said those things, just to try to promote the infection, control side of things. And I think, yeah, I haven't seen too many issues alcohol related. And yeah, overall, I think from the substance use perspective, things are doing all right. I think, yeah.
That's good. That's good. And it's very different than what I was expecting, in the sense that because of the stress and the isolation and no community, I thought maybe substance use will go even higher, and maybe, with some more related deaths, especially with the opioid piece, right? So happy to hear, and cocaine. Happy to hear that actually is going well. Is this something you would like to write a bit about, to share on the challenges, and also to share on some things that went better than expected, or that you thought will be good and they ended up being good, yeah.
It's rather anecdotal right now. I don't know if we have the time at present to do a proper.
Yeah, then forget it. But capture notes, because this really is very important, right, for the go forward on the approach, etc.
Yeah, and I think one of the strengths in our region is that even if people are, trying to, and some people aren't following physical distancing quite as well as they should. Often homes are, a few family members are in a cluster of homes close together, and so people are kind of still visiting between homes a little bit. But I think in many ways, people in Sandy Lake and other First Nations have much stronger community and social connections. So I think in that way, people are actually probably doing better than people in the city who only social life is, the water cooler at work, not going to work.
Yeah.
I think there's a stronger sense of community and versus the individualism that we see elsewhere. So I think there's a stronger sense of community that's guiding many of the decisions and the work that's being done, both health-wise and in the community. So myself and one of the other community members have been doing weekly radio shows, and there's some really excellent questions. We've been meeting with community leaders. There's an election upcoming. So as you may know, the Indian Act requires communities to have an election every 2 years. And if you don't, then you don't get government funding pretty much. So that election was supposed to be end of March. The federal minister did allow communities an extension given the pandemic. But the community still wants to have that opportunity to have their voice. So we've been working on a safe plan to have an election, et cetera. So there's a lot of different things going on at the community level, really working on the priorities of keeping the community and the elders safe.
That's amazing.
Wow. That is, yeah.
I wonder if Sol has questions or comments, Sol, from your end, that you are exposed also to the other policy issues. Sol, anything from your end? Did we lose Sol?
No, he's right here. His mic's on mute.
Okay, you know that I cannot see any face, Irma-Jean. For some reason, my video is not working. So that's okay.
So yeah, there he is. Okay, no, he's on.
Great.
Yes, certainly. I think I just want not necessarily just maybe a comment. I think we're hearing some stories or truth-telling stories that should be able to make make it into public policy, right? So, and I think I'm always been as you know, I did a lot of quite a bit of health administration management and some of the work that I did.
Free MPP.
Yeah, so,
Mhm.
so I understand how the system works and how I was talking about how jurisdiction plays a role and how jurisdiction kind of how jurisdiction can kind of like make things uneven or
Yeah.
and sometimes maybe not equitable to the health, the standards that we have. For example, like there's provincial legislation on how you provide care, on how you're going to do immunization, example. But on reserve, on federal responsibility, there's nothing in that is in legislation to be able to do that. So I guess one of the things I could ask is, it's because of the size of the community. Like I know that with the nursing station model, is it working for Sandy Lake, or I could kind of say in a way, or another question could be is,
Can you change the picture, please?
or
Oh, okay, the slide?
Yeah. Kyle, could you put it so that we see the speaker or no, never mind, there you go.
This
Okay,
is how
we're good.
we adapted.
Yeah.
or is Sandy Lake, would Sandy Lake be ready for a hospital model of care? That's kind of like a general question.
Well, and so to add to that, before our colleagues take it over, what we are proposing is that we actually learn from all the, indigenous peoples, communities, First Nations, and others, that it needs to be community-based more than hospital-based. That has been a bit of a problem that we believe at RNO we have had. We relied on the hospitals, and they were extremely well prepared, and yet community care, whether it's home care, primary care, etc., plummeted.
Yes, I think the issue is you have it right. And
You have it right. Exactly.
That's why when you said the truth-telling stories, that was one of the points I wanted to make, is how can we capture those stories to help us shape the system that will work better? The term I have often used is called journaling, and it probably isn't useful here, but the storytelling to really capture what actually happened and how did your community really overcome this.
Specialists told that we issued yesterday, and we will send you this week, a report, ECHO, Enhancing Community Care, and we speak there about community care, not only hospital care for COVID, next wave, third wave, whatever wave, and in general. So you guys have it right, and we need to, I think those stories will help us give life to ECHO in a big time. So maybe you can tell us how can we help you capture them.
So I think I'd like to get back to the question that Saul asked, which are legitimate questions. So as you said, from the community level, from the prevention standpoint, I think the community has done very well at trying to set up, as robust, basic public health measures as we can. But from the treatment standpoint, that is an ongoing challenge, as Saul raised. The nursing station that we're in was built around 1970. It's a very small building, which does not meet the needs of the current size population. We acted creatively, as you can see by the pictures that Greta has shared here, kind of walling off different sections of the nursing using tarp to try to create respiratory zone versus clean zones with screening at the door and so forth. But those zones are like basically small offices with cupboards from 1970, right? There's no air circulation, there's no negative pressure rooms, any of those sort of things. So we've done our very best with the facility that we have. Sandy Lake was approved for the construction of a new facility, which construction is ongoing. We asked that it be built to meet the actual needs of our population, and Health Canada said that was too expensive. So they'll basically replace what we have now, and then that was over budget, so they actually slashed. So the new building will actually have fewer offices, one more clinic room, but fewer offices than we have now. So that's, yeah. The large question of a hospital model, I think, is a challenge that I think many of the services that hospitals provide in the sense of, you know, surgery and CT and stuff like that. I think even if we had a hospital here, like some of the communities in the James Bay region do, I would suspect that the vast majority of things need to be sent out. But that's a larger question. In terms of COVID specifically, one of the challenges we've had is that we would like to ramp up the ability to treat if we did see an influx of cases, despite our best attempts at, you know, public health prevention. We know that many of the hospitals in the city very quickly back in March realized, oh no, we're going to need more oxygen and masks with viral filters. And there was a pretty significant delay in terms of some of those things happening at the Health Canada level, despite excellent attempts from Heather and the nursing managers in Sioux Lookout. It was a challenge working that through the bureaucracy of the federal system, as Saul mentioned. So a partnership has been developed in the last couple of weeks so that Sioux Lookout First Nations Health Authority has been given the funds from Health Canada to be able to purchase some of those things. So we still right now, for example, have no viral filters, meaning that if we have to put someone on oxygen that might have COVID, we don't have the right attachments to prevent that COVID from spreading throughout the nursing station room, which has no negative pressure, which has no HEPA filter, which has no room, you know, cleaning processes. So those filters, the filter parts apparently finally arrived in Sioux Lookout a few days ago, but many of the other supplies are still, because the challenge is, as again, Saul was mentioning, the federal versus provincial system. The federal system is not set up to respond quickly to meeting needs.
If I could just add to that from an outside perspective, seeing the federal and the provincial and then our local First Nations Health Authority working together this is a good thing that has come out of COVID. In the areas where the federal government have not been able to respond quickly, the province has stepped in. But I want to say to that, if so, to your question is this nursing station working? Not really. So in that new build, yes, there was some cutbacks, but why can't we learn from this experience of the province, the First Nations, and the federal government working together, because it's so much more effective. So when the province was approached about funding part of the nursing station to do the public health and the dialysis support, they were turned down. And when that building was redesigned, the chunk of the building that got cut was everything health promotion, prevention, primary care, the fundamentals of healthcare. So whoever made those decisions obviously was not a healthcare practitioner or have any sort of health background. So that's something, if you're able to advocate for with Sandy Lake, because it's still going to be missing in the new center. Yeah, maybe Lisa's right. I'm not sure we need an operating room or a hospital, but we need to be able to continue providing the acute care services, but we need space and a good environment to do prevention and promotion.
And actually, COVID-19.
Many of the programs, so Greta and her program are like across town from us. Mental health is across town from us. We asked the new building allow all of these programs to be under one roof, and we're told by Health Canada that's too expensive, tough luck. So that makes it really challenging for things like this best practice thing work to go ahead, is that we can't all be in the same building. So if the nurse is seeing a patient, they can't just grab the doulas, or the other way around. Yeah, home care, all the different programs.
And actually right now, COVID-19 has really demonstrated what the value of health promotion and prevention really are to saving lives. And what we've discovered, I guess, with ECHO 3 is that we need to jump on this opportunity that's right now in front of us and make it work for our asks, I guess.
And the same with what our colleague just mentioned on the partnership between the different levels of government. So in a city, it's also the issue of the federal government, provincial and municipal. And we are pushing that with you guys also, the 3 levels of government and with First Nations. I think that this is a silver lining. I mean, if you look south of the border, that one was blaming the other, and it still is, and scoring political points. The approach here, all in all, I would echo the comments before, has been working together. And we need to continue to push the working together before, during, after COVID, so that the issues that have been so long not dealt with and so long an injustice, right? Don't get perpetuated more and more, but we try to come out of it by together really providing the supports for the work that you know how to do, because you know best how to do that, right? The self-determination of you creating your programs. So, yeah, so Sol, I don't know if given your experience before and now, what would you suggest is the best approach to push for the issues from your end?
Certainly, I know that so there's certainly inequalities and inequities and even kind of like human rights issues that are at play with respect to some of the, like, access to clean drinking water is an example. Like, I know, I think Sandy Lake is on the fourth water advisory, so it's
water advisory.
yeah, so it's an issue, right? Like, and I think you know, like say for example, I think you know, when I used to talk to Health Canada, and you know, like they would always say, don't mention hospital on reserve, because we, you know, we're not in a business of healthcare. That's what they would say. And then the provincial government will say, you know what, we don't build infrastructure on reserve. You know, there's these places in place, like and we have to understand that you know, these systems that are at play, whether it's provincial, federal government, these are colonial systems. These are, I used to say that when I it wasn't until later in the year or later in when I was working in health how the systems worked, and I thought they were you know, broken, but in actuality, they're actually designed exactly the way they're designed, working exactly the way they're designed to, which is to take away the rights of our people from the lands and the resources that are up there. So that's very key. But I think that, you know, like I think keep starting to talk like that, whereby, you know, where you actually have perhaps maybe even satellite hospital, like in Sandy Lake, like when you you know, why cannot we have you know, dialysis in the community? Why can we not have some long-term care beds in the community? You know, like those type of things. Like, we have to kind of have these thoughts, and but infrastructure is so important too when we talk about hydro, when you talk about water. So
yeah. Yeah, I don't know if Angela wants to bring some remarks. Maybe she did already, I don't know.
She did at the beginning.
Oh, thank you. I would like to, if you don't mind. And I don't see if Cheryl is still there or is not, because I cannot see any camera.
Cheryl is here.
Okay. So to all of our colleagues, in Sandy Lake, and to the ones that have not attended, that are not here, and to really, to your people, those that are not health professionals, to the community and to the elders and to the youngers also that are playing, I think, and should play a big role in demystifying COVID, so that people can really do the best for keeping care of themselves and others, right? So thank you. It's incredible. It's admirable, the work that you're doing, always, always, and now even more so. My wish would be that may the shortfalls of injustice in terms of, you know, not having the resources and needing to close so that you can keep out the virus as much as possible. Serve for once I'm asking, the powers in the universe for once to would serve as a positive and demonstrate for once that if we learn more from you, if we listen more to you, if we do more being close to the land and taking care of one another the way that you do like nobody else, may those become the strength that we learn from for others, and strengthening the process also the positioning, and I say it in purpose, the positioning and the power base of Sandy Lake and other communities, so that together we can push to open new doors and end the endless injustices and discrimination that has been. May COVID give us a silver lining on that.
Oh, lovely. Now I know, Greta, you wanted to do a cheer, unless Saul, you were going to do some closing remarks.
Cheer. Yeah, I'd like to thank you all for coming together for this presentation together. And as you know, that it started in March 19, that there's a cheer that happens locally at 7:30 p.m. if I'm correct, Doris?
Yeah.
That's correct, 7:30. And I don't know if you can see it, but I'm going to do a live because I didn't have my post and pants.
And this is for all frontline workers, whether they I don't know, nurses,
For every single frontline worker.
everybody that's in prevention of COVID. Let's do a cheer together.
Okay.
Let's hear. Thank you, thank you, thank you.
Thank you.
Our colleagues. I believe Carl was there today, and I don't know if Sabrina is there, that helps us always. And I know Cheryl, my hubby is there. So everybody, Angela, I don't know if Angela is there. Karen, everybody, and Lisa. Kudos. Thank you.
Doris, I was wondering if we could record this, if everyone is okay with that.
Thank you.
Oh, we need to do again now?
If everyone's okay with us recording.
Oh, good.
So I can record it.
Thank you so much, and thank you so much for joining us, and take care. Happy Nursing Week to all the nurses, amazing people.
Yeah.
What a tribe we have.
Yes,
Thank you.
Okay. Bye, everyone.
Bye-bye.
Great. It was a great
My
event.
pleasure.
Thank you.
Joining you guys this afternoon.
Bye-bye.
Bye.
Thanks all.
Bye. Thanks all. Thank you.
Bye. Thank you so much for sharing.
He's still there.